This video is for informational purposes only. It is not intended to diagnose or treat any medical condition. If you suspect you or someone you know may have borderline personality disorder, seek help from a qualified mental health professional. Always consult with a healthcare provider for diagnosis and treatment. Understanding BPD requires a deep dive into its complexities. This video aims to shed light on BPD's symptoms, causes, and treatment options. Remember, professional guidance is crucial for managing mental health conditions. It's essential to differentiate between general information and personalized medical advice. This video serves to educate and inform, not to replace professional diagnosis or treatment. Always prioritize consulting a healthcare provider for accurate diagnosis and customized treatment plans. Mental health is intricate and requires professional intervention. Borderline personality disorder is a mental health condition characterized by intense emotions, unstable relationships, and a distorted self-image. Individuals with BPD often experience rapid mood swings and difficulty controlling their emotions. This disorder can lead to impulsive actions and problems in relationships. The complexity of BPD makes it challenging to understand and diagnose. It was first identified by Adolf in the 1930s. Stern described patients who did not fit neatly into existing categories of mental health disorders. He coined the term borderline to reflect this ambiguity. Understanding BPD requires a multidimensional approach. It's not just about the symptoms, but also about the person's experiences and the underlying causes. This video will explore the various aspects of BPD to provide a comprehensive understanding. The goal is to offer insight into BPD's symptoms, historical background, causes, and treatment options. By the end, readers should have a clearer picture of this complex disorder. Adolf, a pioneering psychiatrist, made significant contributions to understanding BPD. In the 1930s, he noticed a group of patients who did not fit the typical profiles of neurosis or psychosis. These patients exhibited fluctuating symptoms, complicating their diagnosis. Stern introduced the term borderline to describe this intermediary state. His work laid the foundation for future research and understanding of BPD. He emphasized the importance of recognizing the unique challenges faced by these patients. Stern's observations highlighted the need for a distinct category within psychiatry. His insights helped shape the diagnostic criteria and treatment approaches used today. Stern's work remains influential in modern psychiatry, guiding clinicians in identifying and managing BPD. Stern's legacy is seen in the continued efforts to refine the understanding and treatment of BPD. His initial identification has paved the way for ongoing research and clinical advancements. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, defines borderline personality disorder as a pervasive pattern of instability. This includes instability in relationships, self-image, and emotions. Individuals with BPD often experience intense episodes of anger, depression, and anxiety. According to the DSM-5, BPD affects various aspects of life, making daily functioning challenging. People with BPD may have a chronic feeling of emptiness and fear of abandonment. These emotional struggles often lead to impulsive behaviors, such as substance abuse or self-harm. The DSM-5 criteria stress the significant impact of BPD on interpersonal relationships. Relationships are often intense and unstable, with alternating extremes of idealization and devaluation. This instability can lead to significant distress and difficulty in maintaining long-term relationships. Understanding the DSM-5 criteria is crucial for diagnosing and treating BPD. It provides a structured framework for clinicians to identify and address the disorder's complexities. Accurate diagnosis is the first step toward effective treatment and support. Section 5. Etiology, causes, and contributing factors. The etiology of borderline personality disorder, or BPD, is multifactorial. Genetic, environmental, and social factors all play a role. Research suggests that a combination of these factors contributes to the development of BPD. Genetic factors may predispose individuals to BPD. A family history of mental health disorders increases the risk. However, genetics alone do not determine the onset of BPD. Environmental factors, such as childhood trauma or abuse, significantly impact the development of the disorder. Social factors, including unstable family dynamics and chronic stress, also contribute. These factors can disrupt emotional regulation and lead to the development of BPD. Understanding the interplay between these factors is vital for effective treatment. Identifying the causes helps in developing targeted interventions. Effective treatment addresses not just the symptoms, but also the underlying factors contributing to BPD. Comprehensive care involves a holistic approach, considering all aspects of a person's life. Section 6. DSM-5. Diagnostic criteria for BPD. The DSM-5 outlines specific criteria for diagnosing borderline personality disorder, or BPD. These criteria include a pervasive pattern of instability in interpersonal relationships, self-image, and emotions. At least 5 of the following symptoms must be present for a diagnosis. 1. Fear of abandonment. 2. Unstable relationships. 3. Identity disturbance. 4. Impulsivity in at least 2 areas. 5. Recurrent suicidal behavior or self-harm. 6. Emotional instability. 7. Chronic feelings of emptiness. 8. Inappropriate, intense anger. 9. Transient stress-related paranoia or dissociation. Each criterion reflects the complexity of BPD. Fear of abandonment can lead to frantic efforts to avoid real or imagined separation. Unstable relationships often involve extreme idealization and devaluation. Identity disturbance is marked by an unstable self-image or sense of self. Understanding these criteria helps in recognizing BPD. Accurate diagnosis involves a thorough clinical assessment. It is crucial for developing an effective treatment plan and providing appropriate support. Section 7. Impact of BPD on interpersonal relationships. Borderline personality disorder, or BPD, profoundly affects interpersonal relationships. Individuals with BPD often experience intense and unstable relationships. They may idealize someone one moment and devalue them the next. This pattern leads to significant relational turmoil. The fear of abandonment is a central feature of BPD. This fear can result in desperate attempts to avoid separation. These behaviors can strain relationships and create instability. Partners, family, and friends may find it challenging to cope. Emotional dysregulation in BPD contributes to relationship difficulties. Intense emotions can lead to impulsive actions and conflicts. Misunderstandings and emotional outbursts are common. Support from loved ones is crucial but demanding. Understanding BPD's impact on relationships is essential. It highlights the need for empathy and effective communication. Supportive relationships can help manage BPD and improve stability. Section 8. Treatment options for BPD. Effective treatment for borderline personality disorder, or BPD, involves a combination of therapies. Dialectical behavior therapy, commonly known as DBT, is one of the most effective treatments. DBT focuses on teaching skills to manage emotions, reduce self-destructive behaviors, and improve relationships. Another effective approach is cognitive behavioral therapy, or CBT. CBT helps individuals identify and change negative thought patterns. It focuses on improving emotional regulation and reducing impulsive behaviors. CBT provides tools for coping with stress and building healthier relationships. Psychodynamic therapy explores unconscious processes and past experiences. It aims to uncover underlying conflicts contributing to BPD. This therapy helps individuals gain insight into their behavior and develop healthier coping mechanisms. Family support plays a crucial role in the treatment of BPD. Involving family members in therapy can improve understanding and support. Family therapy addresses relational dynamics and helps create a supportive environment for the individual with BPD. Section 9. Role of family support in BPD treatment. Family support is vital in managing borderline personality disorder, or BPD. Understanding the disorder and its impact on relationships is crucial. Educating families about BPD helps create a supportive environment. Involving family in therapy can improve treatment outcomes. Family therapy addresses relational issues and helps develop healthier communication patterns. It provides a platform for family members to express their concerns. Support from family can significantly reduce stress and emotional turmoil. It helps individuals feel understood and valued. Family members can also learn to set healthy boundaries. Creating a supportive environment involves patience, empathy, and understanding. Family support can enhance treatment and improve quality of life for individuals with BPD. Section 10. Importance of professional help. Seeking professional help is crucial for managing borderline personality disorder, or BPD. Accurate diagnosis and effective treatment require the expertise of mental health professionals. Therapists, psychiatrists, and counselors play a vital role in providing the necessary support and interventions. Professional help involves a comprehensive assessment to understand the individual's symptoms and challenges. This assessment guides the development of a personalized treatment plan. Therapy, medication, and support groups are common components of a comprehensive treatment approach. Regular therapy sessions provide a safe space for individuals to explore their emotions and behaviors. Therapists help clients develop coping skills and strategies to manage their symptoms. Medication may be prescribed to address specific symptoms, such as mood swings or anxiety. Support groups offer a sense of community and understanding. They provide a platform for individuals to share their experiences and learn from others. Professional help is essential for managing BPD effectively and improving overall well-being. Section 11. Encouraging note on living with BPD. Living with borderline personality disorder or BPD can be challenging, but it is possible to lead a fulfilling life. With the right support and treatment, individuals with BPD can manage their symptoms. Therapy, medication, and family support play crucial roles. Progress takes time. Patience and persistence are key. Celebrating small victories can boost motivation. Building a strong support network is essential. Hope and resilience are central to living with BPD. Many individuals with BPD have overcome significant challenges. Inspiring stories highlight the potential for a positive future. Encouragement from loved ones can make a significant difference. With the right resources, individuals with BPD can lead meaningful lives. A brighter future is always within reach. Subscribe, like, comment, and share for more.